This is a presentation about asthma by Emma Libby and Brooke. What is asthma? Asthma is a chronic illness that can affect anyone from any age, gender, weight, or health. Asthma leads to limited airflow in and out of the lungs, and while it is not necessarily always active, it can flare up in severe bouts called asthma attacks. There are about 3.8 million Canadians that live with asthma. To understand asthma, we must first understand the normal function of the system that it affects, which is the respiratory system. In normal physiology, air enters through the nose or mouth and passes through the airway and into the lungs. As we inhale, we bring oxygen into our bodies, and as we exhale, we let carbon dioxide escape, which is typically a passive process. Our airways are made up of the nose and mouth, pharynx, larynx, trachea, bronchi, and the branching bronchioles. Alveoli, which are found at the end of the bronchioles, are small pouches lined with squamous epithelial tissue, and they are the location in the respiratory system where oxygen and carbon dioxide exchange occurs. Airway resistance, the surface tension of these alveoli, and lung compliance are all factors that affect the facility of airflow in and out of the lungs. For the purposes of this presentation, we will focus mainly on airway resistance. The resistance is low when the airways are dilated, when the smooth muscles surrounding them are relaxed, and when there is a regular amount of mucus inside of them. All of these factors are disturbed in a person with asthma, which we will be discussing next. Asthma is a disease that affects the lower respiratory system. It can be induced by things such as exercise, changes in the weather, high emotions, medications, and illnesses like colds, flus, and infections. So, what happens when somebody has asthma? Airways respond too strongly to an allergen such as pollen, dust, mold, spores, or animal dander, or an irritant like smoke, fumes, vapors, odors, or chemicals. The hyperreactive response to these stimuli in people with asthma causes antibodies, called immunoglobulin E, to bind to mast cells in the lungs, which causes the release of compounds such as histamine and triggers an inflammatory response. This is irritating to the respiratory system and makes the airways and the muscles surrounding them inflamed, which causes them to constrict. The irritation also causes more mucus to be produced in the airways, which can lead to obstruction, making the airways even more narrow. Because of the narrowing of the airways, the alveoli may hyperinflate, causing air to become stuck in the lungs. As asthma sufferers try to force this stuck air out of their lungs, it can cause a high-pitched whistling sound, known as a wheeze. Some signs and symptoms of asthma include wheezing, which is related to the narrowing of the airways, coughing, which is related to irritants that are present in the airways, tightness, heaviness, or pain in the chest, dyspnea, also known as shortness of breath, losing sleep, which is usually related to difficulty breathing, and increased mucus production in the airways. Some people with asthma may feel like they need to avoid exercising and need to avoid going to social events because of the possibility of an irritant or allergen being present. But with proper treatment, asthma sufferers can still live happy and healthy, active lives. Asthma doesn't have a cure, and its severity varies from person to person, but it can be controlled and managed with proper treatment and avoiding allergens and irritants when possible. The main treatment methods for asthma are medications, which are either quick relief medications to treat an asthma attack as it's happening, or long-term relief medications, which are used to reduce inflammation of the airway and prevent symptoms. Both types of medications usually come in the form of an inhaler. Some examples of fast-acting asthma medications are beta-agonist bronchodilators. These types of medications activate adrenergic receptors and cause the airways and the muscles surrounding them to relax, allowing more space for air to pass through. These medications include albuterol, which is more commonly known as Ventolin, levobuterol, and terbutaline. Some examples of long-term and preventative treatments for asthma are corticosteroids, which suppress inflammation and lessen symptoms such as swelling and irritation. These medications include things like mometasone and cyclosonide, which is more commonly known as Alvesco. Asthma has been around for a very long time, so there are not currently many studies being done on the disease itself, but there is ongoing research about the effects that asthma may have on people's mental health and quality of life. Research is centered around the well-being of people with asthma rather than treatments of the disease. It is reported that some people with asthma may feel anxious or left out due to their disease because they can't do some activities or they struggle when they do an activity. More than 50% of participants in a survey done by Asthma Canada felt that having asthma limited their social interactions. Within the last year, people with asthma have experienced even more anxiety and avoided going places because of COVID-19. They don't want to risk being exposed to this illness, so they stay home. The better someone has control of their asthma, the better the quality of life they have. However, they are still cautious when they may be exposed to irritants. It has been known that having an asthma action plan helps reduce stress because it gives scheduled time to take medications and helps asthma sufferers and their loved ones know what to do if an asthma attack occurs. Asthma action plans are also good to have from an early age. If a child is diagnosed with asthma, it's beneficial to begin an asthma action plan soon so that they learn it from a young age and are able to use it for the rest of their lives. It's important for another adult to know their plan as well, such as a teacher and a parent. This should help them live with less anxiety about their asthma.